The UK needs to be vaccinating up to 5 million people a week to get the coronavirus pandemic under control, according to former British Prime Minister Tony Blair. And he joins us now. Mr. Blair, good morning to you.
Morning, Piers.
You came out with this about a week or so ago, and it really resonated with people. This idea that we should, rather than vaccinate twice in 3 weeks, vaccinate once as many people as possible and then come back with a booster jab later. And it's now been embraced by the government. What made you think of this? And what else do you think we should be doing, given that the government so quickly embraced what you suggested?
So the game-changing thing is we've now got this new, much more transmissible form of the virus. So that means we've got to alter our plans for vaccination. And secondly, we've got the Astra-Zeneca vaccine coming on stream now, which is very simple to use. Unlike the Pfizer one, which we've been using up to now, this is like a flu jab. Very simple, cheap, easy to administer. And we should be getting much, much more of it on stream over the coming weeks. So you've got two questions. You've got the supply of the vaccine, and then you've got the capacity of the system to use whatever vaccine and get it swiftly into people's arms and get the jab done. And so what we've done today is suggest both how you improve the supply side. So we reckon you could get up to 3 million a week by the end of January, 4 million a week by the end of February, 5 million a week in March. And then you've got to use every single available bit of capacity in order to make sure these vaccines are used. And that means altering, I think, completely the present plan that we have. It means all the things that you've been talking about in your programme earlier, like community pharmacies, retired people, occupational health workers. You know, we should be thinking about this on a completely different scale now.
Mr. Blair, I wonder, yesterday we spoke to Michael Gove, who said that they didn't expect to get to even 2 million doses a week until the end of January. You're suggesting 3 million. What makes you confident that that could be done when the government themselves are suggesting it can't?
So you've got two vaccines that are available. We have several million of the Pfizer vaccine. That is more difficult to administer, it's true, and the settings in which you administer it need a different level of expertise. But I believe the AstraZeneca vaccine will be up to 2 million for AstraZeneca by the end of January. They should get it above that in February. And then you've got, as I say, several million of the Pfizer vaccine. Now, if you position yourself properly to be able to use all these vaccines, you should be able to get to 3 million a week by the end of January. And then in February, you can increase that further. And I think you could, if you really throw absolutely everything at this, I think you could get to the stage where by roughly the third week or maybe the last week of March, you've got over half the population vaccinated.
Say about throwing everything at this.
But it requires you to completely alter.
Right, you talk about throwing everything at this, and I've been saying this to the ministers this week, chuck the kitchen sink. It doesn't matter what it costs. In the general scheme of pandemic costs, you know, billions here or there, just chuck it all at this vaccination programme. But if you were actually advising them, and I believe you should have been part of the government advisory committee or whatever from the start, along with other former prime ministers, but they haven't taken you up on that, but they are taking up your ideas. If you were advising them right now, and we've got the vaccine minister coming on, what are the crucial things that you don't think they're doing yet that they should be doing?
So I think the crucial things they're not doing is they're not using every available possibility for vaccinators. OK, so you've been talking about the community pharmacies today. I mean, we should have all of those organised to do this. All the GP surgeries. I think you'll find that not all the GP practices are signed up to this yet. You've got occupational health workers, several thousand of those. They're perfectly qualified to give what is essentially a flu jab. And then I would actually have mobile facilities as well, going around place by place. You could use polling stations. I mean, remember, we managed on election day to get, 30 million people?
Yeah, well, we had this conversation
through
yesterday.
the doors voting.
Yeah, one day, 30 million people rock up and can vote. Why can't we?
Well, especially when primary schools are there and can offer facilities.
But here's what I don't understand, Tony Blair, and you've been in government for a long time yourself. I don't understand why we're still not in the correct position for this, given we've had 9 months to prepare. for vaccines that were being worked on right from the start here. Why are we not in a better position? Why are we not like Israel, which is at the moment absolutely on fire with its vaccination programme?
I don't know, because I think the problem is we've always been somewhat behind the curve and we need to get in front of it. And we've got the opportunity with the Astra-Zeneca vaccine. And this is, British-created vaccine. I think this vaccine, along with the other that we should really focus on now, by the way, there's another drug coming out of the US, but they've got facilities in Europe as well. We've already booked 30 million doses of it. It's the Johnson & Johnson drug. That's very similar to AstraZeneca. In other words, it's a simple jab. It's like a flu jab. They should get their clearance by the end of January, early February. We need to get that shipped as well, because if we do that, we can get that along with the AstraZeneca one, and possibly there's another one called Moderna that's coming on stream. We need to be ramping all of this up. And we just need to go on to a completely different footing with it. I mean, you see, with the simple to use and administer vaccines, there's really no reason why you don't need a very complicated system to do it. I mean, I get a flu jab every year and I get it at my local pharmacy. Yeah. It's not complicated.
You see, the trouble is that the government dragged its feet over testing, over PPE, over masks, over care homes. Too often it has been, and of course with lockdowns, too often it's been behind the curve. I think so many people think, come on now, when it comes to the vaccine, now is the time to, as we've said, throw everything at it. The fear is that they will do exactly what they've done before, and they won't. You are saying a lot of shoulds. They should do this, they should do that. I don't understand why they wouldn't in this situation. And I wonder whether there is an issue, for instance, with the fact that the MHRA has to quality control every single batch of AstraZeneca in order for it to be sent out. There must be practical reasons, because otherwise none of us can understand why this operation isn't now up and running 24/7.
Yeah, no, it's a really good point, Susanna. So look, there will be issues. I mean, the MHRA on the whole, I think, have done a really good job. They're really good people. They're working flat out on it. But that's why it's going to take us 2 or 3 weeks to get to the full AstraZeneca strength of 2 million a week. Not this week or next week, but the week after, they should be able to get up to 2 million because the batches will be cleared. There may be a few bureaucratic glitches around that. We have to look at that. But I think if I was back in government now, what I'd say to the people who are helping me with it is, look, give me a plan by the end of this week to get up to 5 million doses by the end of February, early March. We know these batches are coming on stream. We know that we're going to have the vaccine. I need to see that you've got all the logistics and organisation in place so that whatever vaccine is supplied, we get it out and into people's arms as quickly as possible. And there's another reason for doing this, which is that what we're learning about this disease, and I'm afraid this is going to be a big, big problem for us in the future, is that it is a bit of a cat and mouse game. And so you've got the risk, the longer you delay this, that you get another variation of the disease, which is more difficult for us to deal with. Yeah. So you've got the one that most people think of as developed here, but it was actually just discovered here. But you've got the one coming out of South Africa, which is much more worrying. And you could have further mutations of the disease. So the quicker you do this vaccination programme, the better it is, not just to get us back to normal, but also to fight the disease.
There was a moment yesterday when Patrick Vallance was asked when he first called for a lockdown, and he pointed back to SAGE papers from the 22nd of December, which were published a week afterwards, ending with a warning that has now been borne out by rapidly increasing infections, effectively implying we just moved too late here, as we clearly did back in March. If you had been Prime Minister and SAGE had given you that report on the 22nd of December, would you have ordered a national lockdown immediately?
Well, it's difficult, to put yourself in the position. I hope I would have taken account of the advice that they'd given. I mean, I don't blame the government for investigating it carefully. I mean, you're shutting down your economy. So in one sense, to be honest, Piers, I'm deeply sympathetic to the scale of this challenge and to the fact that all the time you're trying to manage risk, because there's a risk in not locking down and then there's a risk in locking down to the economy, to other healthcare provision and so on. But I think when you look back on it, and it's easy to do this in hindsight, but when you look back on it, no, we were too slow to lock down. What I think is now absolutely essential is that we learn the lessons of having been behind the curve. We have the opportunity on vaccination now to get ahead of the curve. We should be the best country in the world on vaccination. I mean, look, to be fair again to what the government's trying to do, we're, I think, the third biggest vaccinator in the world right now. But the point is, with this Astra-Zeneca vaccine, which I think will become the global workhorse vaccine, we should be able to be number one. Yeah. And I think if we really position ourselves differently, we can be.
How important is the military in this? I know you've discussed with me before that one of your regrets with public health crisis you had to face was not bringing in the military earlier and bigger. Would you be using them a lot more now?
Yeah, for sure. The thing about the military is, you know, what you learn in government, and it's, you know, you kind of think you're the most powerful person in the country because you're Prime Minister, and you think, if I give an instruction to the system, something happens. And what you learn over time in government is, no, not necessarily. Often nothing happens. When you ask the military and they give an instruction, it happens. Yeah. And that's the difference. And so you accelerate your ability to deal with practical problems because they're used to a command and control structure. So someone says, go and deliver, you know, X thousand vaccinations, and the next day they're delivering it. I mean, that's the difference.
Will you have the vaccine yourself?
Yeah, of course. I mean, look, if you told me I could go and get the vaccine now if I went and queued for 3 hours to get it, I would do it in a heartbeat. Well, yes, of course.
Exactly, and we've had somebody who said
it's going to become, by the way,
So I was just going to say, Tony Blair, someone who said their elderly mum would go out at 3 o'clock in the morning to get it. I mean, I think this is the thing, isn't it? If you had to wait for it, if you had to queue for it, if you had to go at a ridiculous antisocial time of the day, you would just go and get it.
Absolutely, 100%. Because, by the way, the other thing that's going to happen, and there are two things in addition we've got to prepare for. One is, I don't think we have the proper data systems yet, and we've got to get them. We need to know every single piece of information as this vaccination programme proceeds, because it will tell us an immense amount about what's working and what's not working. But the second thing is that I think you will get to the stage where it's going to be very hard for people to do a lot of normal life unless they can prove their vaccination status. Yeah. I think you'll find a situation where countries say to you, you're not coming in here unless we see whether you've either been vaccinated, you've had the disease and have got antibodies, or you've had a recent high-quality test. And so if people have got to understand vaccination is going to be, in the end, your route to liberty. So you may think it's a constraint on your liberty, you've got to go and get vaccinated.
Can you explain why we still don't test anybody coming into this country?
No, it's, look, I have not understood from the beginning why we don't do this mass testing. And that is something, I know what the reasons are, but I don't think they're correct in the end, and I think they should have been overridden by the government. But testing people coming into the country is absolutely essential. Yeah. Because
we've never done it. Michael Gove, when I asked him yesterday, I asked Michael Gove, he didn't know how many had been tested. The truth is, the answer is 0. We don't test people coming into our country. We still don't. It's unbelievable.
No, and if you go elsewhere, by the way, in the world nowadays, I mean, the governments that are getting on top of this, virtually all of them that I know, in fact, all of them that I know of, require a test. Yeah. They often require a test before you come in, and then they test you when you get there.